Hi everyone. For those of you who are just joining us, thank you so much for coming to our virtual open house here through the University of Global Health Equity. My name is Kara and I'm the Academic Programs Coordinator here. And we are going to start off with a brief overview of who we are and specifically our master's degree program. And then we will open it up with a current student and alumni to ask any questions you may have. So without further ado, I'm going to pass it over to the Assistant Director of our Master's Program, Phaedra Henley.
Hi everyone, this is Phaedra Henley. I'm the Assistant Director of the Master's Program. I'm so excited to be with you guys tonight. So thank you for joining us at this virtual open house. We're here with a lot of our team from UGHD who are here ready to listen to your questions and give you all the advice you need to make your application successful to the MGHD program. So how it's going to work today is I'll give a brief overview of the university and the master's program. We'll then go to a panel with, we have an alumni and we have a current student as well as myself and Kara, who's our academic programs coordinator, who can answer all of your questions, so be sure to have those ready. We're going to do a Q&A at the end, and you can ask your questions via the chat. If you've come in by a phone, we will prompt you at a certain time that will unmute the phone numbers, and you'll have a chance to ask your question orally. If you have any problems throughout the info session, please send a message to the group chat and we will try our best to address those. So the last thing before we get started, if everyone could send us a message with your first and your last name, your country of residence, and your email address. That would be very helpful. So again, I'm just going to give a brief overview of the university and our programming, and we'll go to the panel, and then you can save your questions until the end, and we'll be sure to address all of them. So the University of Global Health Equity is a new university based in Rwanda, where we're building the next generation of global health professionals into leaders and change makers who strive to deliver for equitable quality health services for all. So here at UGHD, we bring a new approach to recruiting and training the next generation of health professionals. UGHD is an initiative of Partners in Health and is led by internationally recognized faculty and staff from all around the world. We are an independent university and builds on Partners in Health's 3 decades of experience in delivering health services to the world's poorest communities. So at UGHD, we incorporate cutting-edge ideas in higher education, and we partner with top universities from around the world, such as Harvard, Yale, Tufts, and Johns Hopkins, and bring in their faculty from all over the world to deliver a high quality and innovative programming. We have a unique focus on practical experience outside the classroom, ensuring that you, our MGHD students, understand the complexity of delivering care in all settings. Our campus is based in Butaro in rural Rwanda, where students such as yourself will come face to face with global health challenges and work with communities to develop sustainable solutions. So at UGHD, we're on a mission to radically change the way healthcare is delivered around the world. Globally, we know that health professionals, such as future doctors, nurses, global health leaders, are becoming too few, and the training these health professionals receive is far too limited, and it does not address health concerns in our ever-changing and unpredictable environment. But the answer to this is not simply training more doctors and more nurses. The global health education system is failing to prepare students to solve some of these most pressing health challenges like emerging reinfectious diseases and impacts of climate change on human health. What we need are professionals from all backgrounds, doctors, engineers, veterinarians, and environmentalists who are skilled in their own fields, but can also collaborate on transdisciplinary teams to analyze the larger complex picture and determine the root causes and solutions to the problems our generation is facing. If we are going to solve these challenges, we must reimagine global health education, and UGHD is doing just that, and we want you to help us. So how UGHD is doing this is we have several academic programs. We'll be focusing a lot on our Masters of Science in Global Health Delivery, which is why you guys signed up for this virtual open house. We also have executive education programs at MGHD, where professionals in global health, such as people from the Global Fund and other universities, come to UGHD for short courses. We are opening a School of Medicine, which will start in September of 2019. And after that, we have many exciting offerings at UGHD, including a school for nursing, as well as dentistry, and traditional grad programs like PhDs in implementation science. So our MGHD program, the reason you guys are all here tonight, is our Master of Science in Global Health Delivery, and it's the university's flagship program. We first had our started the MGHD program in 2015, and we welcomed our third cohort of students this past September. So the MGHD program is adapted from a very similar program at Harvard Medical School, where a lot of those faculty members come in and teach in the program. The MGHD program provides professional advancement opportunities and career development through mentorship and coursework. As I mentioned, in order to solve some of these global problems we are having, we can't just have health professionals trained in one discipline. As such, our programs are rooted in the principles from many disciplines, such as epidemiology, global health policy, management, health finance, and leadership, all with overarching principles of global health and One Health, which is looking at the health of humans, the environment, and animals. So on this slide here, you can see the breakdown of our MGHD program. So over the one full year, you will address each one of these pieces of the pie. So you'll start off with a baseline in global health equity, learning about the principles of global health equity, our biosocial toolkit, the principles of One Health that I just talked about. This will all be done through case-based learning, experiential learning, and lectures from leading faculty in this field. The MGHD program is also like a mini MPH, or Masters of Public Health. Here you'll learn about how to use evidence to drive decisions. The program's also like a mini MBA, or Masters of Business Administration, and you'll learn about management skills, leadership, communication, and design thinking. The end of our program is a practicum project, so this is the capstone of the program. The last 4 months of the program, you'll be working with a team to address a global health problem. You can conduct a research project, a quality improvement project, and you'll be paired with an organization to address a real problem that the organization is facing and be able to implement the global health delivery skills that you learned throughout the program. So I'm now going to turn it over back to Kara Neal, our academic programs coordinator, to talk about the logistics of the MGHD and about our admissions process.
Thank you. So one of the really unique things about our MGHD program is the fact that it's located in Rwanda. So for those of you who aren't from Rwanda, it's in the middle of Africa, and Our campus is located in Butaro, which is a rural part of Rwanda, about 2 hours from the capital of Kigali. So this program will be a 1-year full-time master's degree program based out of Butaro. So it's a full campus with housing, dining facilities, everything you need. And one of the unique things of being out there is that you really get to interact with the people you would be serving. Another unique thing about our program is we have an extremely diverse faculty, both from Rwanda and abroad. So to give you an idea, we have faculty from Harvard, from Tufts, from Johns Hopkins, from Rwanda's Ministry of Health and the Rwanda Biomedical Center, just to name a few. So we have a constantly growing faculty, and each one brings a different, unique perspective to every course. As Phaedra mentioned, we also teach from this problem-based experiential learning model. So you won't just be sitting in the classroom all day, but you'll be able to go on site visits, interact with the local community. And as Phaedra also mentioned, you'll be taking part in this mentored practicum component. Part of the mentored practicum as well, you will get that faculty mentorship, but you'll also be able to put into action all of the skills you learned throughout the program. And this will be an opportunity for you to design a project with a group and address a global health challenge. So part of this 1-year program includes a 12-week field placement, potentially with a partner organization, to actually develop and implement your project. So in terms of tuition, one of the great parts about UGHD is we do not believe that your financial capacity should determine your ability to become a global health leader. So the costs you see outlined here for tuition and room and board represent the cost it takes to educate a student. But that said, we have significant scholarship support available, and we encourage everyone to apply regardless of financial need. And we will send every applicant a scholarship application, and we will review those and consider every applicant for their unique individual financial status. So in terms of admissions criteria, we've outlined them here. The big one is you have to have a bachelor's degree or have completed it before the program starts. So if you're currently pursuing your bachelor's degree, you can submit the transcripts you have up until now, and then you'll need to give us your final diploma upon graduation. We also encourage applicants from diverse professional backgrounds and nationalities, as we do feel like this interdisciplinary collaboration and these different perspectives from all different cultures and experiences and educational backgrounds really makes our cohorts unique. And then of course, we do require applicants to have a strong desire to address issues of inequity, which is in line with our vision and mission. How to apply. So you can go online to our website at ughd.org, where there will be a link to our application, and you'll be directed to fill out some basic information about yourself and answer a couple of essay questions. And then you'll also need to upload some supplemental documents, which includes your CV or resume, your academic transcripts and diplomas, a copy of your passport, and if you are a Rwandan citizen without a passport, we also will accept the Indangamuntu national ID card. And then the name and contact information for 2 references. And once you submit your application, you'll receive an email confirming submission, and pretty soon we will be sending out the scholarship application to everyone who has applied. So one of the most important dates for this program is February 12th, 2018. It's coming up in a few weeks, and that's when our application closes. So please note that the application closes at 9:00 a.m. Central African Time, which is Kigali time. We'll then move forward with a round of entrance exams. So the top candidates will be invited to sit for an exam with reading comprehension, audio comprehension, and mathematics. And then the top candidates from that pool will then be invited to have an interview either in person or via Skype. And this is a good chance for you to ask any questions of the interview panel and also for us to get to know you better on a more personal level. And then you will be receiving your final admissions notification by March 23rd. And we'll have about 4 weeks to decide if you will be enrolling for the upcoming academic year. So thank you all so much. Again, this is a friendly reminder that the applications close February 12th at 9 a.m. Central Africa time. And there is contact information on our website, and you are always more than welcome to reach out to us by email if you have any questions, and we'll be happy to help walk you through